We are live on Valentine's night for a little talk about good health, sexual health, hormonal health, anything related to Valentine's health. All right? So, see you back in about 10 seconds. Our whole practice is based on getting you to be the best version of yourself.
Remove the crappy
Everything
foods.
we do is based in the medical literature.
We're going to look at how to get you healthy, not how to get you on medicines, how to get you off medicines.
All right, so what's wrong with this picture? I'm sitting here with my friends Chris and Jordan, three guys in a dimly lit room, no women in sight on Valentine's Day. What kind of video are we about to make? We're going to talk about good health. If you're new to us, I'm Dr. Gary Huber, and we run an integrative practice in Montgomery, Ohio. And integrative, we want to get you really healthy. We want you feeling good your whole life and off drugs and feeling vital. So I thought, and Chris thought, and others in conversation, it's Valentine's. Let's do a live discussion. Let's ask anybody. You can, for the first time ever, it shows you I'm truly mentally insane. I gave you my cell phone number. Text me or call, but with any questions you have related to sexual health, men's health, women's health, hormones. And I posted a few little ditties this week on Instagram. And we're gonna dive right in there. You know, when we talk about good health, we don't like talking about sex, right? But it's important. It's one of the most important relationships in your life is your relationship with your spouse. And having a good sex life is simply healthy. It's good for you. And studies have shown couples with healthy sex lives tend to live longer. They tend to have less stress. They tend to have less heart disease. So, you know, if you're going to be here, you might as well enjoy the ride, and you might as well be with somebody you love and be able to be who you really are. So if you've got challenges, and you know what, if you have a challenge in your sex life, welcome to the majority, right? Everybody's not walking around with, you know, stud Stallone and that kind of ability. So these things happen in time, especially as you get older, as you get into your 30s, 40s, 50s, and 60s. And by the way, that drive shouldn't go away just because you've crossed the 35-year-old threshold. Sorry, Chris, but it doesn't. It stays with you. But let's talk about some topics that are important, because I think one of the things that I find really provocative is most people, and I would say even a handful of doctors, don't know that women make more testosterone than they do estrogen. Let that settle in. We tend to think as women as these beautiful pink creatures that just make estrogen and progesterone. But women actually make 10 to 15, sometimes as much as 20 times more testosterone than estrogen, and their body takes that testosterone and turns it into estrogen. That's really interesting, right? Because that plays a big role in libido. It's not the only thing that plays a big role in libido, but it's fairly important. Some studies have even shown that looking at a woman's testosterone can be more predictive of her risk for heart disease than looking at her cholesterol panel. All right? So it's a very important hormone because it does a lot of things in us. It has impact on our bone and our brain and our heart, but also our libido and just how we feel. Our mood can have a big impact there. As we all age, men and women, we tend to take on more stress and we tend to get less sleep. And if you really want to kill libido in your relationship on Valentine's, you know, stress and sleep are the biggest killers of hormones and of sex drive. Chris, go and throw up that first graphic. I got a little Cupid here for you, but I want to share this with you. When women's testosterone is dropping, and men's testosterone, by the way, we'll talk about men in the second half. We'll do ladies first. But men and women, as their testosterone drops, things really get sideways in a lot of different ways. When we replace testosterone in women, which is simple to do, look at all the symptoms that are addressed. First of all, hot flashes and sweats. Some women have this long before they go into menopause. Now think about it. I know you're a stud, I know you're a dude and all that, but how enticed would your lady be if she had flashes and sweat? She's not going to have any sex drive. She's not interested in romance. So low testosterone in women is also correlated with low sex drive, often fatigue. And again, if you're fatigued and you're not sleeping well, low testosterone contributes to a poor sleep pattern. There goes libido. There goes your drive. We tend to want amorous activity. We want our sex drive is healthy when we feel good, when our energy's good. So anything that threatens our energy threatens that sex drive. Sleep problems with low testosterone, moodiness, dryness, memory loss, She can't remember where to go for her amorous activities. But it's interesting because when we replace testosterone, women feel much, much better, as do men. And so it is a very healthy thing to do. It's interesting, when I posted I was going to do this talk, one of the first texts I got from somebody was, well, wait a minute, if testosterone is so important for women, you can't give it to women because we know hormones cause breast cancer. I'm going to spend 2 minutes talking about that because it's important. Hormones do not cause breast cancer, right? There's a lot of myth and confusion, and we've done a lot of other videos talking about that particular topic. And the reality that when we talk about breast cancer, number one, breast cancer is the number one killer of women aged 45 to 65, all right? And 1 in 8 women are going to get breast cancer in their lifetime. So it is a significant issue to discuss. But the cause of breast cancer is certainly not testosterone. That's what we're talking about tonight. And we can even talk about estrogen, progesterone. It was interesting. There was some studies years ago where they looked at 357 women that had breast cancer and an equal number of women that were controlled. They didn't have any issue. And they began to look at hormones, and they found a trend. Women that had breast cancer had very low testosterone and DHEA levels, and women that didn't have cancer tended to have higher testosterone, higher DHEA levels. And when they explored that, they found out that the effects of testosterone on breast tissue was it blocked proliferation, it blocked it from growing. And it actually increased what's called apoptosis, or the death rate of breast cells. So breast cells turn over, they grow, they're born, they die. And testosterone had a wonderful effect on that because it decreased excessive proliferation, which is what can become cancer, all right? So when most people say, we know hormones cause breast cancer, you're talking about drug therapy. We're going back to the Women's Health Initiative. The Women's Health Initiative did not give any women any hormones. They gave them drug therapy, and they saw a 26% increased risk in breast cancer. There was another study, the Million Woman Study, and they saw about a 50% increased risk in breast cancer. But in both cases, they used no hormones. They used drug therapy. They used Premarin, Prempro, or Provera for these women. When somebody looked at the idea of testosterone, because we see that testosterone is higher in women that don't have breast cancer, and some studies were done using testosterone, one of the first studies, they gave them the normal hormone replacement therapies, the bad stuff, Premarin and Prempro, but they gave them testosterone with it. And guess what? There was a reduction in breast cancer by about 26%. And they said, well, the heck with the hormone replacement, let's just give women testosterone. And depending on the study you look at and how long a woman did testosterone, the results were amazing. Way more than 50% reduction in breast cancer occurrence. And if the women did it for more than 5 years, it was more than 75% reduction in breast cancer recurrence in the women replacing testosterone. You say, but what about, I've had breast cancer, or what about women with breast cancer? Once again, there are ongoing studies giving women with breast cancer or post-breast cancer testosterone, and we see ridiculously low rates of recurrence, better rates than traditional treatment. So if you're a woman and you feel fatigued and your sex drive is low, it's worth getting that testosterone looked at, especially if you're postmenopausal. We know it's low if you're postmenopausal, but replacing it can have a huge impact on your general health, but definitely your sex drive and your sex life. So it's a very important topic. If anybody has any questions, Chris has got my number up, hopefully, if he's doing his job, up on the screen. Text me. This is an interesting topic, and I want you to get clarity and understanding about what we're discussing here. But if you're a woman and you feel a lot of the things that we've been talking about, this is something that really should have looked at. And unfortunately, most women don't get it looked at. Their doctors just don't know to look at that. It's interesting. In med school, we are not taught to look at hormones. We're not taught to use hormones. We're taught to use drugs. And so not a lot of doctors have this inside understanding about how hormones work. We do, because that's a big part of what we do. Other things, women will report a loss of sensation over time. You know, they can have things, we're not getting too personal tonight, but having problems with dryness or having problems with response or sensation, things are kind of dull, they're not what they used to be. There are therapies to treat that. We use something called PRP, which is platelet-rich plasma. We draw your blood, we spin it down, we take out the growth factors, and then we insert those growth factors. And it can really restore pelvic health, and it can have an impact on stress incontinence, and we do things for dryness. We do something called the O shot for women and the P shot for men. But these are inserting growth factors into that very important region to help stimulate better sex drive and sex response and improve the quality of that relationship, okay? So it's interesting stuff. When we talk about guys, so we're not going to get any women questions, huh? When we talk about guys, it's interesting because we see a lot of talk in the media about low testosterone in men. It's interesting because 30s, 40s, 50s-year-olds, we're seeing a drop in testosterone. It's interesting what's causing it. Chris, who's with me tonight, loves to talk about plastic. It's his favorite topic. I'm joshing him a bit. But we do find that exposure to plastics is having a big impact on guys having lower testosterone at much younger ages than what used to be. All right, so measuring testosterone in guys is important. Replacing it, also very important. Most guys under the age of 60, if their testosterone is low, they don't need testosterone. They need therapy to stimulate their testosterone, which is something we do. And it works really, really well. And you can replace testosterone a number of different ways. We have done other videos, and I want to kind of bring some of this information together. We've done videos on erectile performance and on Gainswave. But an erection is a multitude of different physiologic responses, only one of which is testosterone. You have to have good blood flow. You have to have good neurologic function. And for that, for guys that are having some erectile dysfunction, using a process called the Gainswave treatment is amazing. It's an external, non-invasive sound wave treatment that breaks up microplaque in the vessels and stimulates new vessels. So you're stimulating blood flow and nerve regeneration to the pelvic area. Voila, we're younger now, okay? So things work better. So doing Gainswave, we're running a special this month in our office because it is Love Month. It's the month of February. We're running a special this month, and we've knocked $900 off the cost of a series of treatments using the Gainswave device. We'll get lab, you'll meet with our dietitian, you'll meet with me, and we're really going to go the extra mile to make sure that you get a great result. We want to see that improve for you because it's important. We know in both men and women, but in guys in particular, we see erectile dysfunction is a predictor of heart disease because it's a blood flow issue to some degree. So if erectile dysfunction is creeping up, it's a sign that you could also have cardiovascular issues. And we do a great job of evaluating both of those things. So if you're a guy and you're interested, having some challenge, catch it early. Don't wait for it to get worse. That's the thing. You think you're the only guy in town with a little bit of drop in function. You're not. You know, more than 50% of guys by the age of 50 are already reporting some degree of erectile dysfunction. So it's something that's common. Shouldn't be embarrassed about it. It's something that can be remedied, and it's easier to remedy when we catch it early. A little more difficult when we wait and it becomes really problematic. So talked about that. I can't think if there's anything else I wanted to bring up. That was it for the most part. Do we have any questions, Chris?
So sex, ha 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 ha.
Ah, ha, 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 ha.
So
let's talk about sex.
seriously though, what is the real importance here of having this conversation? You know, is it just something comical? Like, what value does not only the organs but also the act enable for your overall health?
Yeah, the act itself and your overall health, that loving relationship, the amount of endorphins that are produced, it's amazing when studies start looking at, you know, having that relationship. There's no relationship more important in your life than your spouse, right? You say, well, my kids, huh? But that relationship with your spouse is deepened by intimacy. So studies looking at blood pressure and heart rate, cortisol levels are better in people that have a good relationship. We know that, you know, when couples are married versus guys that stay single their whole life, there's an advantage to having a mate in your life, and there's a deeper advantage to having good intimacy. And that's the problem. Some of the things that we talked about tonight are so easy and so simple. And so many couples, they push away from intimacy because they don't feel like they're their best, right? They don't like the way they look, or they don't like how well they can perform, or they feel less than who they want to be. And it doesn't have to be that way. Having the relationship in your life that's easy and comfortable, where you feel confident, it has an impact on your nervous system in a really dramatic way. you would look at your nervous system and say, well, if I exercise or meditate or do different prayer, these things have an impact on my nervous system. They do. But intimacy is a very powerful impact there. And that's very significant in your risk for heart disease, dementia, Alzheimer's. So it plays a role in your risk for degenerative disease down the road. It's interesting when you begin to look at the science of it. The science is a lot more boring than the actual sex talk, but it's true. What else?
So as far as, like, of course, we got Gaines Wave, and we've got, you know, other things that you know, you'll talk us to death about, right? So
I think that was a slam.
So what is the like what can help? What is one food out there that can have a drastic change on performance?
Well, if we're talking about food and performance, you know, you watch the movies and you have oysters. It's an aphrodisiac, and there's not a lot of science behind that. But when we do talk about foods that create inflammation in your body are going to erode, number one, your desire, because it's going to erode your hormones. So guys that have erectile dysfunction, if they're eating a high-carb diet, they're eating lots of sugar and carb and bread and crackers and pasta and those kinds of things, those high-carb diets that drive blood sugar up and drive you toward diabetes, man, diabetes, I'm sorry, it is a boner killer. It is. It kills erections because of the impact it has on the blood vessel. So diet does play a big role. Guys that eat a healthier diet, and this is true for women as well, all right? So if the diet isn't good and carbs are high and sugar is rising, it creates inflammation. Inflammation drives mood. And so people that have mood swings, anxiety, depression, driven by diet, which is very common, they don't have much libido. Libido comes when we're calm and happy and we feel good about where we are. Then the libido naturally rises out of a balanced set of hormones. But anything that stresses us will begin to make that less than ideal.
So since you're our therapist tonight,
I am. What would you like to know?
So, I mean, how important is it to also, how is communication? How is that important to overall health? Between partners, you know, whether there's an issue or anything else.
Or anything else? That's a little bit. You're gonna fill that one in. How important is communication? You don't want me to tell my really off-color joke, do you? But communication, very important. It's interesting. We just, in January, did our mind-body mission, and we talk a lot about, you know, how we process information and what do we think, our egos, and again, it's very simple in a relationship where there's two of you and you know each other so well. But it's easy to develop some friction. And with that friction, the ego gets hurt. And so the relationship, when it begins to turn from what can I do for her versus what has she done for me, then there's challenges, all right? So, you know, our mind-body course really digs into you looking at your own mindset and keeping yourself in a good place for open communication. But yeah, communication is key, as we know, for the health of any good relationship.
All right, so you mentioned the mind-body mission. Okay, cool. Is it a course I can take?
Yes.
That you offer? Is it in office? Is it online?
Yeah.
How can I see it?
So our mind-body course was something we did in January, and it was a lot of fun. We recorded it. There were 6 hours of content, and I'm really proud of the work that we did. We took the work of about 12 different authors, so people like Eckhart Tolle and Matthew Ricard and Judson Brewer and a host of other authors, and we took their works and we kind of boiled them down into some essential points. And we looked at the role of the ego in your life. We looked at how you assess situations, stress. You know, we just talked about relationships and how stress can ruin testosterone, but also ruin your libido. And how do you make decisions? How do you decide how to color your world? You have the ability to take control of that. We talked about the craving mind and how the brain craves sugar or it craves alcohol or it craves bad things, and how you can take control of that, because that's key. So that mind-body course has 6 hours of video content that you can view at home in the comfort of your home. It's available as a video that you can watch along with the book that goes with it. And the book offers, you know, some bullet points, but also a place for you to kind of store notes. And if you're interested in that course, contact the office. The course is $69. It's awesome. I'm really proud of it. We're going to do it again probably toward the end of the year. We're going to rewrite some of the information, add some new information to it. So that was version 1. And I really think it's a critical part of anybody who truly wants to be healthy, right? Anybody who wants to change their status in life. And we've done some videos. We did one a couple weeks ago talking about happiness and talking about ego. But the Mind Body Mission is a much broader work, much more comprehensive. So I really encourage that because I think that contributes to good relationships and good communication, which leads to good sex.
So I'm curious about other things we haven't talked about tonight. How can I hit you up on Facebook? Can you answer a few questions there? Should I call the office? Email? What's the...
If you've got true concerns about your own personal health, contact the office. So area code 513-924-5300. Call the office and just tell them you want to make an appointment. Whether you want to meet with Chelsea, my dietitian, to look at your lifestyle and look at your diet and make some changes and lose some weight, or you want to see me and look at everything from sexual health to diabetes, hypertension, any of the medical problems you have. Because very likely, if you're on medication and you don't feel ideal, by changing your lifestyle and changing habits, we can work to get you off a lot of those medications, improve your hormones, improve your thyroid function, and get you feeling good. That's what our office does. So our phone number is 513-924-5300. Follow me on Facebook or Instagram. I have many patients that come in, they see me every 3 to 4 months or maybe every 6 months and they go, I was doing good and then I fell off the wagon, right? And then they say, if you were in my ear more often, I would be more on task. I would be more consistent. So I listened, and that's why we're here. I'm here every week doing live videos. We have a lot of videos on Facebook. If you go to Huber Personalized Medicine and look at our Facebook page, we have lots of videos there. We have a YouTube channel, Dr. Gary Huber, YouTube. And go look at our playlist. We have dozens and dozens of videos on many different topics. And they're all fairly brief. They're just there to kind of guide and educate you on what a really healthy lifestyle looks like. Go to Instagram. Again, Huber Personalized Medicine on Instagram. And I tend to throw out comments throughout the week to try to keep you on track. Our practice is all about you helping to become the best version of you. As I like to say, life's a limited time offer. So get on it, man. TikTok. Time's going by. Be your best starting right now. All right? So look me up on any of those media links, and happy to develop a relationship if we don't already have one. All right? Very good. Well, I didn't get any provocative questions about lubricants or other things. I hope you're having a good Valentine's Day, and I hope you're with somebody that matters to you. And if things aren't ideal, understand that's an important relationship that shouldn't suffer, shouldn't struggle. There are things you can do, and if you're having any challenges at all, I want you to reach out to us. We've got lots of solutions. All right? Have a good evening and a happy Valentine. Take care. Bye now. Coming up, Valentine's Day, Cupid had his arrow and you got yours. Is it working? Come see us if it's not. Let's get you in peak physical condition. You know what I'm talking about.